Good morning, everyone. Today we are looking at emotional injuries or attachment injuries in couples and the role of counseling. So in the previous week's session, we have looked at mainly on how infidelity can affect the couple relationship. And then we have very briefly discussed on the counseling, forgiveness therapy, counseling very specific to these kind of emotional injuries. So today we'll focus a little bit on the counseling or the therapy aspects, and apart from infidelity, what other situations come under these emotional injuries and how this counseling is different from the usual CBT or other counseling situations between couples. So looking at attachment or emotional injuries, when a particular event that is considered by at least one partner as being an emotional hurt, and then from then on it is defining their relationship, acting like a block for the development of the couple relationship, we usually consider or look at it as an attachment injury. So it is like a block, an impasse that the entire relationship after the incident is dependent on this emotional injury. So it is considered by at least one partner as a breach of trust, like in infidelity, and there are other conditions. We will look at them shortly. And basically here there is a kind of strong feeling by one of the partner of being betrayed or loss of trust, on which their secure attachment is considered to be based upon. So looking at the other situations, the different kinds of situations where these emotional injuries or attachment injuries between couple act as a block for their further development or growth in their relationship. So like I mentioned, when one of the partner, the injurer, who usually consider as a breach of trust or something that is violating the basic secure system of the couple relationship, any incident that they come across in their life together is considered to be an emotional injury. So here, this can happen in a couple of examples where this kind of injuries can be observed when partner, especially the husband, not being emotionally supportive during or after the childbirth, and especially if it is a difficulty associated with the childbirth, and around that there can be a significant emotional injury to the wife. And when wife try to kind of belittle or put down the husband in front of their family members about his ability to provide or take care of the family needs. So could be one of the emotional injury that a husband might go through. And a partner not accompanying or not being supportive to visit a dying parent can be an emotional injury. And situations where one of the partner had a major success and then the other partner is not really participative of this kind of a life-changing, successful situation can also considered to be a kind of an injury. And it can also, as we have discussed, infidelity or the extramarital affair considered to be all the more painful, creating a block in the further growth of the relationships. These are some of the situations we can look at where the couple might go through emotional injuries, and then looking at how these couples are the needs of this, or the relationship, or how these kind of emotional injuries are different from other common couple problems that we deal in the counseling. So generally, when we say emotional injury, it is a block that is defining the relationship of the couple, and it is one of the partner, especially the injured partner, considers it to be basically a pivotal event or a breach of trust, thereafter affecting the relationship of the couple. Here, the underlying hurt, or the underlying unacknowledged emotions that are not being acknowledged is considered to be a block in the relationship, and it will start affecting the other general dissatisfied areas, marital dissatisfactions, into a much more crystallized kind of a situation, and make it much more tougher, and then affect the relationship altogether. So here, what is required in these conditions is a authentic, sincere apology and remorse by the offender, and then being able to be with the person, and then help the person to, and then acknowledge the hurt, and then able to kind of be with the person and be empathetic. The being empathetic is considered to be a very important aspect here. When we look at empathy, we all know what a sympathy is, that being kind to another person who is in a kind of painful situation according to, different perspectives. But then here, empathy is very much important in close, intimate, or otherwise close emotional and family relationships, where you are able to understand the pain of the other person. Especially in emotional injuries, the empathetic understanding of the injury, especially felt by the person who is going through this kind of hurt, is very important in the counseling aspect. So here, the other communication issues, and generally when couple approach for counseling, they may not come with this particular injury as such, but then it might come up as in the discussion, where it can be acting as a block for the further development of the couple relationship, and then it need to be acknowledged and worked through. Sometimes the person or the couple might actually come up with the injury openly, that how it is affecting their relationship. Generally, when they are living together, they decide to live together even after the incident that has supposedly emotionally hurtful. That's when the block happens. Here we are not majorly looking at the shock of finding out an emotional injury, or the immediate crisis situation like finding out an extramarital affair, or the effects immediately. So it is not dealing with the shock. So we are talking more about how over a period of time, a minimum of 2 to 3 years, where there is a block because of this emotional injury, and there is a stagnation in the further relational growth of the couple, and it starts affecting their overall marital satisfaction. So this is how the general situations or the general problems of the couple are different from these emotional injuries. Okay, a little bit on understanding the attachment theory. Since we consider them as attachment injuries also, or rather emotional injuries, a little bit on the attachment theory might help the listener to understand the background a little more better. So when we look at attachment theory, generally when attachment theory is of childhood origin, where the availability of the mother in times of need, and in times of the emotional need, emotional availability of the maternal figure is considered to be forming a secure basis for the child, especially as young as an infant, where the secure bond between the infant and the maternal figure based on the availability of the maternal figure able to meet the needs of the infant, where the secure trusting relationship is formed. So there are certain attachment styles that have originated out of this attachment theory, where a secure kind of attachment happens in an infant and childhood, which usually extends to their adult attachments as they grow up also. A secure kind of attachment where the mother, even though the mother is absent for a while, the infant or the child is more confident or secure that the mother will return. And there is some amount of wanting to have a kind of closeness or a kind of, secure kind of closeness with the mother, which is expressed in the secure kind of attachments. There are other kinds of attachments like an ambivalent kind of attachment, where even though there is an attachment, but it is more associated with the anger and a kind of a confused or a kind of ambivalent feelings attached here. So anger as well as attachment together, making the relationship a little more ambivalent. The third kind of attachment style is the avoidant kind of a style, where there is usually when the child comes in contact with the mother after a short separation, there is a kind of detachment and a kind of anger, and then especially a kind of avoidant trying to be away from the mother. Avoidant kind of behavior is seen in these kind of avoidant style of attachment. So these kind of basic attachment styles will start as they move on, as the child moves on into an adult kind of relationship. The love relationship between people is mainly guided by these attachment styles. So when people are usually of secure attachment with the maternal figure, supposedly are more trusting and provide a little more secure and warm relationship in their how the way that they relate to their marital partner or a long-term partner. And then in ambivalent, generally there is a kind of worry about being abandoned or emotionally some kind of unstable kind of worries that they hold in the adult relationships. Whereas the avoidant kind of people who are usually in their adult love relationships or committed relationships are usually worried about intimacy. There is a kind of fear of intimacy, and they usually try to avoid getting deeper into the attachment or relationship. So this is how the attachment that is formed a strong basis as a child can affect the adult love relationship, especially the couple relationships in the committed kind of situations. So looking at what happens in the counseling per se, how this counseling is different from other areas of counseling. Here mainly the main focus of counseling is based on the theory of forgiveness. So here when a particular partner is in a little bit of vulnerable or hurtful situations, the other partner, who supposedly the offender or someone who has injured the partner, will equally have this kind of stress or feelings of depression, and then willingness to help the vulnerable partner to understand, and then to kind of understand or bring the unearthed or unacknowledged negative feelings that are blocking the relationship, and then helping the partner to kind of pave the way towards more forgiveness and healing the relationship. So here the main focus is on bringing out these unacknowledged hurt feelings, and then trying to understand them in the light of how they are blocking their relationship, and understanding how they are hurting the attachment styles and then trustworthiness of the partners, and then how they are affecting the overall relationship closeness of the partners, and then trying to reframe the kind of role this kind of injuries are playing, and moving on with a sincere, authentic apology, and then a remorse expression and understanding from the offender side, and then which is helping the person who is hurtful towards moving on towards forgiveness and then rebuilding the trust. So this is how the counseling is focused on in different steps. And then forgiveness is not a one-time thing that you just tell that you are forgiven, though it can be a process. And sometimes there can be a kind of setbacks, and it might take some time for the couple to smoothen their relationship and move on with forgiveness and able to rebuild their relationship towards a much more satisfying and much more rebuilding the trust all over again. So looking at the outcome, how effective is this kind of therapy? So especially the person who is hurt or the injured person has usually, the research, according to the research, there is a significant relief in the pain and hurt in the injured person's psyche, and then it actually helps them to relieve and then move on with a better rebuilding of the relationship. And especially when this kind of block is hurting the relationship and it is not being resolved, the person who has gone through the hurt is usually prone for psychological problems, kind of depression, or it can be something long term which is affecting their psychological trustworthiness in the relationship. And the person who has done the offense, if both the couple have decided to be together in spite of this emotional injury, it is important that they resolve it so that they are able to move on from here and then rebuild their trust all over again. So as the research shows, there is a significant improvement in their marital satisfaction, and then a relief that is expressed by acknowledging these hurtful feelings, and then the injured partner able to move on the path of forgiveness, which is helping to kind of build the relationship again back to, or much more better in terms of their marital satisfaction and their quality of relationship. So this is in brief that I wanted to share in today's session. Hope this brief session will be helpful to those people to understand, especially when you are stuck with hostility or a significant anger and unable to bear the other partner over a period of time. It is important that there can be some hurt, something that is blocking your relationship, and then able to take care of it, either with the help of counseling or identifying and becoming aware and working through in your own methods. Thank you all.